Presenting just a before and after picture set, a case study without any lesson from that unique case to me and to my subscribers is such a mundane and insipid affair. Every case we know is unique. How the hair grows, what the patient's objectives and goals are for the future, whether he is compliant to medication or not, varies from case to case. And so does the result. And so do the lessons that we learn from each unique case vary from one patient to the other. No two hair growth journeys are similar. So I am of the firm belief that any hair transplant video is incomplete without a learning motive. Like in this middle-aged person, an Indian male who received for his grade 3 male pattern baldness around 2,800 scalp grafts and who has been regularly taking finasteride and other advice has been complied to. And you can see the result, which later on in the video I will show, after just 6 months of his hair transplant. What are the points which differentiate a good hair transplant from a hair transplant which is badly done? Every person who has baldness may not be a candidate for a hair transplant. This is point number 1. If wrong choices are made, if wrong patients are declared fit for a hair transplant, even with the best of technique, the outcomes will be far less than optimal. Massive swelling after hair transplant is an indicator of the level of trauma that the skin in the scalp endures during the procedure. And this has a direct bearing on the results, the outcomes. In the immediate post-operative period, both the recipient area and the donor area should look neat. No signs of excessive bleeding, excessive trauma. The grafts in the recipient area should look discreet. They should look well trimmed out, small in diameter. They should not be bathed in a pool of blood or a congealed mess of clotted blood that is confluent over the recipient surface. Pain is not a good sign after hair transplant. It is also an indicator, like swelling, of the amount of trauma that the scalp tissue has endured during the procedure. There should be no restrictions in activities of daily living immediately after the procedure. In fact, the patient can return to his office the very next day, of course with certain restrictions in activities. Normal exercises are allowed after 3 days. He can undertake his walking, light treadmill, and heavy exercises after 7 days of the procedure. The procedure should not entail harvesting more than is required, since the patient's long-term goals and objectives are to be kept in mind. It is not that we harvest all the grafts in one go. Over-harvesting leads to excessive shock loss in the scalp donor. Remaining graft availability in the scalp donor becomes entrapped in confluent scarring, and this does not behove well for future procedures because graft extraction in dense scarring is well nigh impossible. So the duty of the hair transplant surgeon is to continue to maintain the integrity of the scalp donor, which is sacrosanct. Because disfigurement of the scalp donor leads to aesthetic deformities which may kill your self-esteem, your confidence in self, much more than baldness itself would. Hair transplant done alone in progressive baldness is of no use. A holistic approach to hair transplant, where hair transplant is combined with medications, is the best way forward. And lastly, the result should always follow within 6 to 9 months after the Thank you for watching. At our clinics in Mumbai and Chandigarh, we take pride in the fact that we do safe and effective hair transplant procedures, which mostly end up in optimal results and happy outcomes. This is because we do one patient in a day. Most of the procedure, as most of my subscribers know, is done by me personally. And our tagline, one doctor, one patient, one clinic, continues to guide us to maintain the trust that we have acquired in the hair transplant community. Well, thank you for watching, and if you have any questions, any doubts that come to your mind, do not hesitate. Just drop a comment, your question in the comment section below, and I'll be there to help you. Thank you for watching again, and God bless you.